Hopefully they behave themselves on television.
Much better this round.
Hello, Susan. Good evening.
Hello, Dr. Subhash. How are you today?
I'm fine. Thank you very much. How are you?
Doing very well. I'm very close to the weekend now.
Yeah. Thank you very much for joining us.
Oh, absolutely. No problem. We're getting very close to just sort of being stuck here at home. Got a lot of new cases today.
Oh, I
So,
see.
yeah, they're really, I suppose I could have had other plans for tonight, but whatever they would have been, they'd been canceled by now.
Can you all hear me?
Dr. Vina, I think your speaker is muted. It's great, Doctor. We can hear you.
Thank you.
Thank you, Doctor. I think it's the right time to start our program. Hello everyone and hello from Malaysia. Welcome to our program of Biosafety and Biosecurity Month October 2020, a month to raise biosafety and biosecurity awareness. Thank you for joining us on our 7th webinar of Biosafety and Biosecurity Month October 2020. Our today's webinar is on the new emerging diseases and disaster management preparedness from One Health perspective. We will begin the session shortly. Before kicking off today's program, I would like to remind some of the housekeeping items. Please mute your microphone and only unmute when you're required to speak. Make sure your camera is on and look at the camera while speaking. Please feel free to introduce yourself to all participants using chat. No cell phone call or interruption during the session. Please treat everyone with respect. Just be ensured that all our webinar sessions of Biosafety and Biosecurity Month will be recorded and uploaded on our YouTube channel for the viewing of everybody. At the end of the session, there will be an evaluation survey. Give your feedback through the evaluation survey. Each feedback is highly appreciated. We will be using the chat function on Zoom to ask questions and to introduce all participants. Thank you for your attention, and once again, welcome to our program organized by AIMST Institutional Biosafety Committee as part of Biosafety and Biosecurity Month October 2020 at AIMST University. My name is Kanchana, and proudly introducing myself as biotechnology final year student of AIMST University. It's my great honor to be MC of today's webinar. If there is any issue with the audio or video, please let us know through the chat. We will try our best to resolve the issue. Now, I would like to request IBC Chairman, Senior Associate Professor Dr. Subhash to speak a few words about Biosafety and Biosecurity Month at AIMST University, as well as to introduce our today's moderator. Dr. Subhash, the floor is yours.
Thank you very much, Kanchana. A very good morning to everybody. Good morning, good afternoon, good evening, because we have participants from 3 different time zones. So on behalf of AIMST University, as well as on behalf of Institutional Biosafety Committee of AIMST University, I welcome you all. First, I want to thank all of you for taking time to attend this webinar. And I believe, because we are going through a difficult time, I hope your family members, friends, loved ones are safe and they are in good health. AIMST University is observing October 2020 as a Biosafety and Biosecurity Month. This one we are doing second time. We started last year. The main aim of this exercise, Biosafety and Biosecurity Month implementation, is to raise the biosafety and biosecurity awareness among our students, staff, stakeholders, and all associates of AIMST University. However, since we are going online, so we have made it accessible to everybody. Anybody can join us and learn more about biosafety and biosecurity. To promote biosafety and biosecurity, we have organized 12 webinars. So today's number is number 7. Another 5 are coming up in next week. So make sure that you will not miss next week's another 5 webinars. We also have a poster presentation competition, which is at the end of this month, 30th of October. And students are encouraged to participate in poster presentation competition. I firmly believe that all these activities, those are organized under Biosafety and Biosecurity Month at AIMST University, will help all the participants to raise their biosafety and biosecurity awareness and learn different elements of biosafety and biosecurity. Nowadays, everybody should be familiar with the biosafety and biosecurity because now we have a global disaster because of pandemic, and that one also helped to raise the awareness about the biosafety and biosecurity. Altogether, we have around 280 participants registered for this Biosafety and Biosecurity Month. But this number will be more because for internal circulation, we send directly the Zoom link, login ID and password. So many those are busy. So they just use the login ID and password which we send. So without registration, they attend the webinars. So definitely this number will be more if we consider that one. So we have participants from 12 different countries. We have participants from registered participants from Algeria, Australia, India, Indonesia, Japan, Libya, Malaysia, Nepal, Nigeria, Philippines, United States of America, and Vietnam. Excuse me. So I want to take this opportunity to thank senior management of AIMST University, because without their support, it's not possible to organize these types of activities. So I do appreciate senior management of AIMST University for giving freedom to Institutional Biosafety Committee of AIMST to implement the Biosafety and Biosecurity Month to promote the biosafety and biosecurity. I want to take this opportunity to record my thanks to all the members of Institutional Biosafety Committee for their full support in implementing the Biosafety and Biosecurity Month. And our today's speaker, Dr. Beena Rai, she is also our faculty faculty member in Faculty of Medicine. I want to thank her for accepting the invitation to deliver today's talk, and I do appreciate for her helping hand to give this interesting talk. So Dr. Beena, thank you very much for accepting the invitation and becoming a part of Biosafety and Biosecurity Month activities. Most importantly, I want to thank Dr. Susan Kelly, who is going to moderate today's session. I'm very grateful to her because she's from different time zone. Time there, it's 8 p.m. late evening. It's a family time, and she's sacrificing her family time for us to moderate the session. So I do appreciate her time and willingness to moderate our webinars. So in addition to that one, before I stop, I want to take this opportunity to announce that in next week on Monday, we will have a very, very special webinar and dialogue session. So I want to make sure that all of you will join that one. It's something you should not miss it. It's very, very important because we have invited coordinator of Malaysian One Health University Network. Professor Latifa is a coordinator. She's coming and she's sharing with us lots of interesting things. We have invited our collaborator, Dr. Puk from Vietnam One Health University Network. He's a coordinator of Vietnam One Health University Network. We have invited him, so he will be sharing lots of things from Vietnam perspective. And our students, biotechnology students, are working with Vietnamese students under the umbrella of Vietnam One Health University Network. So he will also, we are happy he's going to come and join us. So make sure that you are marking your calendar. That one is at 10 o'clock on Monday, Malaysian Standard Time. So make sure that you will attend that one. It's a very, very important session. And we also have the regional coordinator for, regional coordinator from the biological threat reduction program, United States of America, Mr. Christian Kando. He will be joining us, and many members of the US government are likely to join, and it will be a very, very important dialogue session. So please mark your calendar. I'm taking this opportunity to invite you and alert you about the Monday's program. So last but not least, I want to take this opportunity to thank our biotechnology student. I'm very proud of biotechnology student because I feel so relieved because they are working very meticulously and very sincerely, and they are quite brilliant. So they are helping me and the institutional biosafety committee to implement different activities which we have organized. And because of them, it's quite easy to implement the Biosafety and Biosecurity Month at AIMST University. So I want to record my special thanks to biotechnology students of BSc Biotechnology program of AIMST University. So once again, thank you all of you for coming and joining this webinar. So without further ado, I request MC Kanchana, please lead the way.
Thank you, Dr. Subhash. Now, I would like to request our today's moderator, Dr. Susan, to introduce our speaker and begin the session. Dr. Susan, please.
Thank you very much. I'm honored to be with you all in what is my evening and is your morning. I think that 2020 has been a very interesting year for all of us, hasn't it? We've all been surprised by the way that COVID-19 basically spread across the world, and it's been devastating. But in some ways, I wonder why we were surprised. After all, throughout human history, diseases have emerged. Some of them have been less serious than COVID-19. Some of them have even been more serious than COVID-19. But in some ways, we did know this was going to happen. We just didn't know when or exactly what it was going to be like. And this is the problem with emerging diseases. There are so many unknowns in the beginning. Many countries did well in response to COVID-19, given that it's a pretty difficult disease to control. Other countries really struggled, even if they had a disaster management plan in place, even if they'd practiced for years and spent lots of money on testing and medical capabilities. Still, they seem to be caught off guard. And that's why it's extra important that this year we take note of the lessons that we've learned, the successes that we've had, and the failures, so that we can do better next time. Whenever you want to do better at something, the fastest way to do that is find someone who's already done it before and has learned some of those lessons for you. So if you want to follow somebody into COVID-19 or any new emerging disease, you might want to pick our speaker tonight. Dr. Saraswati Binarai is an associate professor in the Faculty of Medicine and a retired consultant in public health for the Ministry of Health. She has a strong background in public health, and by strong, I mean 34 years of experience. That's a lot of lessons learned. You should definitely leverage that. She was the head of the epidemiology unit in Penang for 13 years before retiring in 2017 to become a part of AIMST University. Not only is she trained in the Global Outbreak and Response Network, she's also trained in the Epidemic Intelligence Program in Malaysia. She's still a trainer and a supervisor for them. She's also on the AIMST COVID-19 task force. So if you do have to respond to COVID-19, she's likely out there somewhere. You might want to go with her because she's done this before. She's dealt firsthand with some very serious diseases: H1N1, SARS, the original one, Nipah, brucellosis, and many other diseases. It's because of her expertise that she was a consultant for the World Health Organization in 2014 when Typhoon Haiyan hit the Philippines. She's now the honorary secretary of the Malaysian Medical Association Penang branch and the chairman of the National Cancer Society of Malaysia, also Penang branch. She's also involved in a host of other activities, a very busy person. This allows her to entertain her interests in field epidemiology, outbreak investigation, and probably her favorite of all, I would imagine, outbreak investigations into zoonotic diseases, which is important because most emerging diseases these days pass from animals over to humans. Hence, they kind of start as a zoonotic disease. So I can't think of anyone better to tell us how to prepare for disaster management in the event that a new and emerging disease arrives on your soil. Given that we know that will happen, she can help you through it from a total One Health perspective. If you would please turn your attention now, I'd like to welcome Dr. Saraswati Binna-Rai.
Thank you very much, Dr. Susan Kell. That was a very kind introduction. I'm impressed. And there are some very big shoes to fill, I think, because I've been retired for the last 3 years, happily retired, by the way, and not so much into the active field, which I wish I was, but I'm not. So, yes, shall I start?
Yes, please.
Let me share screen, please. Oops. Okay, I'm not getting my screen. Okay, sure. All right. Good morning, everybody from Malaysia. Thank you so much to the organizers. Thank you so much, Dr. Subhash, for inviting me to give the talk today. And thank you, Susan, for the very kind introduction. So I've been given this topic, which is called the New Emerging Diseases and Disaster Management Preparedness from One Health Perspective. So as I was preparing this lecture or this talk, I was thinking this is more like something I would give to the students, actually, because disaster management is a topic that we teach our third-year medical students. I've tried to put it all from a whole perspective and sticking to the scope of the topic given to me. So let's see if I do justice. But I still feel we can never do enough justice for what is happening right now. I can only skim the surface, touch it, and hopefully along the way, I'll be able to answer the questions that you all ask me or that the participants ask. So just a little bit about the scope, because it is pretty wide. I've gone into One Health perspective and a little bit on the public health preparedness. And that is about how far that I can get today. As you said, our diseases continue to catch the will of God. But again, like what Susan said, we shouldn't really be caught off guard. Throughout the century, at least the whole of 21st century that I know about, we've been preparing for that big one. We've had so many simulation exercises. We keep saying a very big pandemic is about to occur. We thought H1N1 was it, but it wasn't. In a way, it fizzled out as fast as it came. And also, SARS came in and left. We thought it would linger forever, but it didn't. So continuously, we are fighting known and unknown diseases. And just when we think there is one that has gone off, another one comes along. And what Malaysia has done, which I think we are very proud of, how we have managed COVID, is because we have had SARS, we had Nipah, we had H1N1, and we have learned from the lessons learned. I mean, we have learned from all of those lessons. But in between all that, there are also some really unusual diseases that have turned up and maybe did not get the attention that it desired, but we like to keep it small. So diseases that we actually thought are retreating have made a comeback, and nothing can beat the COVID-19 that we're facing right now. So let's see. I have to still introduce the idea of One Health. So no matter what way we look at it, the health of the people is connected to the health of the animals and our shared environment. We live in a world where we are in very close contact with animals, with the environment that we live in. And if you want to protect any one of these three, you have to help to protect all. So none of these can live in total. In so many ways, we are interrelated. And as human beings, we are encroaching into other people's turf. And also, we think animals are coming into our turf, but most likely we are the ones who are at fault anyway. So, what is the One Health approach? It is a collaborative, multi-sectoral, transdisciplinary approach. So what it means is we don't work in total. We don't work as a silo. So everything and every job and whatever we do, we have to now look towards working with others, working with all the people who are involved in our scope, and we need them as much as they need us. So the best way to do it is to work together. And this not only has to be at the regional levels, it has to be national, global, and also right down to the local levels. So if we want the best health outcomes, we have to always recognize that there is this continuous dynamics that is going on between animals and humans and our environment. And the interesting thing is, this concept is not something very new. If you remember Hippocrates, he wrote in 400 BC about airs, waters, and places. So this idea was actually formulated a very long, long time ago. Maybe not formalized, but definitely thought about then. So just skimming in through first right now, the common One Health issues that we encounter, definitely zoonotic diseases take the top, right up there is zoonotic diseases. And together with that,
Dr. Bina, please unmute yourself. Dr. Bina.
right, someone muted me. And together with zoonotic diseases, we have antimicrobial resistance, which is a very big problem today. And as much as I would love to go into the details of antimicrobial resistance and how we are abusing antibiotics, this is not my topic today. So I will just mention it in passing. Another big thing is food safety and food security. Food safety is a very big problem right now. And as we all travel, as we all try all kinds of food, as we are fighting for food, I have to put that in inverted commas, that is another big issue that we face, which also is something that we have to think about in terms of One Health. Vector-borne diseases, definitely environmental contamination, and also the other health threats that are shared by people, animals, and the environment. So really giving an overview of it all, there are so many so many One Health issues that we are fighting with all the time. So when we talk about emerging diseases, we actually refer to both emerging and re-emerging. So what we mean is a newly recognized disease or something that has evolved. The most well-known or the infamous one of the 21st century was SARS, which we really thought it was going to be much worse than what it was. And we move on. Diseases that were a major health problem globally or in a particular country, and then decline dramatically. But then it reappears again and gives another significant problem to the population. So some of the examples like diseases that at one point we thought TB, we had got it licked, but apparently not, because TB has made a comeback. And we have a lot of TB cases right now. And not only just plain TB, we are getting multi-drug resistant TB. And examples of zoonotic diseases include rabies, West Nile infection, Q fever, anthrax, brucellosis, Lyme disease, Ebola. Rabies, Malaysia had been declared rabies free. And then again, rabies came back with a vengeance. And right now in Sarawak, we do have cases of rabies, and we haven't really gotten rid of it. Even then, in about a few years ago, we also had rabies in Peninsular Malaysia. Peninsular Malaysia was considered rabies-free at one point, so much so that we stopped vaccinating our dogs against rabies. But now it's compulsory, back again, to vaccinate all our pets against rabies. So these are things, and we can never be sure that we think we have got it, um, we have gotten rid of the disease, but it does come back. I had to borrow these slides from the Nature Reviews. I know we look at COVID-19, but over the centuries, there have been a lot of infectious diseases, and most of it is zoonotic. The Spanish flu of 1918 caused 50 million deaths, and that was a H1N1 influenza. That was the same swine flu that came back in 2009, a similar swine flu. Some of these diseases cause a lot of deaths. The mortality rate is high, and some are not as high, and some go off not lingering for so many years. For us, I think we really, in our mindset, we had expected a flu pandemic. We did not really expect a pandemic with the coronavirus. So, so let me talk a little bit about contributing factors to emerging diseases. And basically, the underlying problem is the change interactions between humans, animals, and the environment. The first one is population growth. Now, human populations are growing and expanding into new geographic areas. And what happens is that as a result of this, more and more people are living in um, close contact with wild and domestic animals, both livestock and pets. Pets today have become exotic pets. The more exotic, uh, well, probably you are one up on the others. I don't know. Um, Animals, they will play a very important role in our lives, whether it is for food, sport, livelihood, travel, companionship. There are so many reasons. Close contact with animals and their environment. So what this happens is it provides more opportunities for disease to pass between animals and humans. And the population of people living in cities is increasing. 54% of people live in urban areas, and this is projected to be 68% by 2050. So more and more people are actually migrating from rural areas to cities. And of course, the total world population is also projected to increase to about 9.7, 9.8 billion by the year 2050. And on top of all this is international air travel. So this has allowed fast and greater movement of people, animals, and animal products all over the world. War and poverty does not need any introduction. I don't need to state it. So all this causes people to live and interact between animals, humans, environment, and gives more chance for diseases to spread. Just a little bit about travel and population growth. I'd already mentioned global travel. The highest number of people traveling is to Europe, and then is followed by Asia and the Pacific. And world population is growing, and the greatest growth is in Asia. The other contributing factors are destructive ecological changes due to economic development and land use. Um, and with all this, the Earth has experienced changes in the climate and land use because of deforestation, intensive farming practice. And this disruption here in the environmental conditions and habitats, they produce again new opportunities for diseases to pass from to animals and humans. And of course, not only are humans adapting, the viruses and the microbes are adapting to this change as well and are becoming more resistant. And finally, although we may not, there is public health failure in some aspects. So when we talk about disasters and we think about what are the infectious disease disasters, because disasters can occur in many ways, we really think about bioterrorism, which is terrorism with intentional release or dissemination of biological agents. And this could be anything: bacteria, virus, fungi, toxins, or it could also be naturally occurring or modified. And the other disaster which we talk about is emerging infections and pandemics, which can result in a disaster. Many ways that we look at it, COVID-19 is a disaster. And this is quickly for those who may not be aware that according to the CDC classification, they have classified, they have got three categories of classification of bioterrorism agents, which are category A, B, and C. And excuse me. And excuse me. And this is based on the priority of the agents and how much of a risk they pose to national security and at the ease at which they can be disseminated. So if it's a category A agent, these are considered very high priority because number one, they pose a national risk, and number two, they can be easily disseminated or transmitted, and number three, they result in high mortality and they can be transmitted from person to person very easily. So they can have a very major public health impact. And they may cause public panic, social disruption, and they really require special action for public health preparedness. Category B is conceivably could threaten food and water safety. We had a major brucellosis outbreak in Penang when I was a few years before I retired. We had 82 cases. This is something that we had never seen before, at least not in Penang when we were there. And it started off as just one case. And by the time we finished with contact tracing, we had found 82 cases. And they were all non-intentional. And they were just related to drinking fresh goat's milk. The other category B agents could be the toxins of Clostridium perfringens and food safety threats like Salmonella, E. coli, Shigella. You can use anything and use it as a bioterrorism agent. And category C are pathogens that are considered emerging infectious disease and which could be engineered for mass dissemination. Example is Nipah and hantavirus. If you look back in history, history has got some very interesting biological warfare that has occurred throughout the centuries. I can't go through all of it, but when I was reading through the 6th century BC, when the Assyrians poisoned the wells of their enemies with rye ergot, I must say that was remarkably clever. And there have been so many instances throughout the centuries. And I think the siege of Kaffa was very interesting when it comes to mind. And most of the time, people seem to be using plague, which is in the siege of Kaffa. What happened is, just for a very quick review, this was a conflict between the Tatars and the Christians in Christian merchants. So the Tatars were infected with plague. So as they were leaving, what they did was they threw the dead bodies of the plague. They were losing the battle because they had so much of plague. And what they did was they threw in the dead bodies of the plague victims over the wall into the Christians, to where the Christians were. They were hoping that the putrefying stench of the bodies will force them to die. But actually what happened is they caught the plague and they died. And the only thing that they could do was to leave, and they were located near the Black Sea. So what they did is they jumped on their boats and they went to Genoa, they went to Venice, and this was how plague was brought to the West. So throughout history, there are a lot of incidences of biological warfare. So now, let me just move on to disaster and apply to disaster management and disaster preparedness in the public health perspective. So this is the phases of disaster preparedness. And when we talk about it, what we always try to do is to reduce, avoid losses from hazards, we assure prompt assistance to victims, and we achieve rapid and effective recovery. So there are 4 stages every time that we go through. Mitigation is what we do to minimize the effect of the disaster. And what we do in mitigation, we can do vulnerability analysis, or we can do building codes so that the buildings do not crumble under the effect of an earthquake. But for our purposes today, preparedness is the most important, which is planning how to respond. And basically, what we're talking about is a preparedness plan. Response is our efforts to minimize the hazards, and basically it's this response and the emergency relief that you do. And recovery is returning the community to normal. So in a process of recovery, we always say build better, because what we want in the process of recovery is, as you are recovering, we want to make sure that whatever we do, we recover so much better that for the next time it comes around, we are better prepared for it and we are able to withstand it more effectively. So, in any disaster, there's always a gap between resource needs and resource availability. And that's exactly how it is right now. But we are slowly adjusting. When we first started off with our COVID, I know we had shortages in supply of the test kits, we had shortages in supply of masks, but slowly that supply chain has been developed again. And the problem is that so many people will need assistance at the same time, especially in a pandemic, that countries are not really able to help another country because we are all so busy taking care of our own. I had to put a slide on COVID-19. She couldn't die. This is something all over the world. I mean, I just had to put it. I didn't even care what I said about it. So just to say that almost every country in the world is affected with the current pandemic, and some more than others. And so we're all really busy taking care of our own borders. So when we talk about public health preparedness, in the WHO's 16th World Health Assembly in 2001, there was a resolution that was adopted, which was to strengthen national health emergency and disaster management capacities and the resilience of health systems. And disaster management has become a global topic. It is taught also in medical schools, and all countries are being encouraged to improve their disaster preparedness, along with the growing international commitment to strengthen health systems, which is what we need, because public health system is the core, is the strength um, whenever any disease or any disaster happens. As much as we would love to say that it is a combined effort, whether we deny it or not, but we need the public health system to be very strong. And what we need is that lessons identified from disasters to make sure that they are effectively collated. And past experiences we need to build on, we need to learn by it, and we need to apply it and use it to prepare for the future. Because public health threats are always there. So public health threats are under our new and emerging diseases. So whenever we define what public health threat is, it comes under the new or emerging disease. This is the accidental release or deliberate use of biological, chemical, or radionuclear agents. Remember, I have to mention that in a very strange incident that we worked on a few years ago when I was on the field, we actually had cases of a pymetrin poisoning, and all it happened was children eating some very simple food at breakfast, And what we think it had happened is it was the pyrethroids. Somebody would have sprayed accidentally onto the banana leaf, and they used the banana leaf to fold the food up, and children had bought it and eaten it raw. Something so simple as that. So it could be accidental release, or it could be deliberate. And there are, of course, the natural disasters, which are the human and man-made disasters. War is also a disaster. We have complex emergencies, the typhoons, the hurricanes, and also conflicts and other events with a potentially catastrophic impact on human health. And public health emergency preparedness has been described as the capability of the public health and healthcare systems, communities, and individuals to prevent, protect against, quickly respond to, and recover from health emergencies, particularly those whose scale, timing, or unpredictability threatens to overwhelm routine capabilities. So when we talk about preparing for public health threats, it is not really the authorities who need to do it. Everyone, each and every individual has a person, has a community, you have a role to play. I can't just say, even in this management of COVID-19, that, hey, it is left to the authorities. I have my own responsibility and roles as an individual citizen. So, what do we have in terms of? It's not like haven't looked into it. For those who, more for those who are not aware, we have the international health regulations. The international health regulations first came out in 1969, but in 1969 it was only for three diseases. It was for cholera, yellow fever, and plague. So these are the only three diseases that were under the provision of the IHR. But after SARS in 2004, we realized that, hey, really, this is not good enough. So the whole thing was revised, and what we have is WHO has come out with the International Health Regulations of 2005, which are legally binding regulations to protect global public health threats of infectious disease and other public health emergencies. And over 198 countries have signatory to this. And this was officially adopted at the 58th World Health Assembly in May 2005. And it entered into force in June 2007. And all member states, basically member states means countries under WHO, it is a legally binding document. So Malaysia is a signatory to it. Malaysia is a signatory to it. So what you need under the IHR is that all events that may constitute a public health emergency of international concern needs to be notified. And the thing is, before you can notify something, what the mind does not know, the eyes do not see. So we need to know what is it that we need to notify. So we need the capacity to detect such events. And we need a well-established national surveillance and response infrastructure. And under this IHR, we need an IHR focal point, which in Malaysia, the IHR focal point is the Deputy Director General of Health, Public Health. So if anyone outside Malaysia finds something unusual that we think needs to be notified to Malaysia, there is a designated focal point that we notify to this person, but which is actually through the email, and that email is also connected to a few other people, so that in case one person misses it, there is a team that actually looks at it. So you're required to strengthen and maintain the capacity to detect, report, and respond rapidly to public health events. So in translation, what it means is, right down at the lowest level, in case something small happens in, just say in AIMST University, something unusual, something that maybe something is brewing there. We need to have the knowledge to know that this is something unusual, and we have to be able to respond immediately. So under it, you also need to verify any information, whether it's a public health risk, collaborate with the IHR implementation, and every event needs to be assessed using the decision instrument tree that I will talk about in a few minutes, and notify within 24 hours any events that may constitute a fake. We call it fake, but it's a public health emergency of international concern. And under this, there is also routine inspection and control activities at designated point of entry. Point of entry means the airports, the ports. What we want is to spread the international spread of disease. And we make every effort to implement the WHO recommended measures. So, what we have is the national IHR focal points and all the responsible authorities. We have core capacities, surveillance and response at local level, and also core capacity at designated points of entry. And together with that, there are national legislations. I can only speak about our country because that is all, that's where I've been working through, and collaboration and assistance. So the implementation has got to start at the district level. And here in our country, we like to think, and I know that right down to the district level, all our staff have been, all the health workers, healthcare workers have been trained. And it's a continuous process of training that goes on yearly so that they're able to detect, they're able to report, and they are able to control. So if you work at this level, right down to the lowest level of the healthcare system. And if you know that they are able to detect, and they are able to know when they see something unusual, then you can know that as the pyramid goes up at the regional level, they will also know. So the system here is already in place, it's been tested, and it is working. So what are the events that need to be notified under the WHO IHR? Anything which comes under this. If you see smallpox, which already been eradicated from the Western Pacific region, you see a smallpox, worldwide. If you see polio due to wild type poliovirus, if you see human influenza caused by a new subtype, or SARS, you straight away don't think twice, we notify to WHO through our system, which doesn't mean that if you think you pick it up in Sunakotani, we notify straight to WHO. No, it goes through the process, it goes through the state, it goes through the district, state, and then it goes nationally. On the right side is any case of the following: cholera, pneumonic plague, yellow fever, viral hemorrhagic fevers, West Nile fever, or other diseases of special national or regional concern. If you have any of these, or any event of potential international public health concern, including those of unknown causes or sources, we have to apply this algorithm. You have to put it through the algorithm where there are 4 questions that you need to consider. Is the public health impact of the event serious? Is the event unusual or unexpected? Is there significant risk for international spread? And is there significant risk for international travel or trade restrictions? If you say yes to any of this, then it is notified to WHO under the IHR, and only they have the right to declare a disease as a fake. So although in Malaysia we have cholera on and off, we don't have yellow fever, but we do get dengue, which is already endemic here. For it to be considered to be a fake, you have to apply these 4 questions into it. And the IHR in practice is that you've got a 48-hour timeline and a 24-hour timeline. So if you have worked in the health system in this country, you must know that everything is urgent. And we have been trained to report anything, which is why I think our country has done very well, because we get a handle on events quite fast. What makes the Asia Pacific region so vulnerable? There are 48 countries and territories under the WHO region, which comprises Southeast Asia and the Western Pacific region. Here, health security is continuously being threatened. Outbreaks of public health emergencies caused by EIDs, emerging infectious diseases. Very often it occurs around here. Impacts of natural disasters and conflicts. We have unsafe food and water. This is the most populous area in the world, where more than one quarter of the world's population, just one half of the world's population just live in this region. It's a very concentrated area, highly populated. Humans and animals and the environments are in close contact with each other. And a lot of recent outbreaks and recent emerging diseases have come out from this region. We have natural diseases. Like I mentioned, animals and humans are in ever closer proximity. And we also have newer threats, like chemical and radiological emergencies that has arisen from this place over the last few years. And we also get uncommon patterns of antimicrobial resistance. So what we have is, you see, we have guidelines. And when there are guidelines and people have worked towards it, there's really no reason to reinvent the wheel. What we need is to take what has been done, apply it to our system, change it according to our needs, and use it accordingly. And I think this is what Malaysia has done. They have applied this, and as you can see in our control of, especially the second wave of COVID-19, which Malaysia did very well. And now we are in our third wave, but I think, let's just wait and see. So, what is another WHO document? AIMST 2, Asia Pacific Strategy for Emerging Diseases and Public Health Emergencies. You take the IHR 2005, they use that framework and they use it as a common framework to address shared threats. It's a shared platform to work together to strengthen preparedness and response to outbreak and public health emergencies so that we can have an early response. And this was a vital role in keeping COVID-19 cases in the Asia Pacific region. Because if you really look at it, and if you, my earlier map, except maybe for India, the rest of the region has got a very controlled amount of COVID-19 that is seen within all the countries in the Asia Pacific region. And it is really nothing new. The answer is simple. We're just following protocols. So AIMST 3, because it had gone from 1, 2, and 3, and they reviewed it to see and to include the newer disease, it is the roadmap for the Asia Pacific region countries to strengthen core capacities which are required. So effective preparedness and planning, surveillance from detection, and all this, verification, assess, notify. And what we've done is basically through our existing capacities. So only thing we are doing different or maybe is strengthening our existing capacities. And there are 8 areas of focus. Public health emergency preparedness. We prepare for it. We have always prepared for a public health emergencies. In times of peace, what do? We run simulation exercises. Number one, in Malaysia, we run simulation exercises right down to the smallest unit. That means at district level, it is part of their requirement that they have to do one every year. And we do it at the state level. And when we do or run a simulation exercise at the state level, we make sure it is interagencies involving the vet, involving the National Security Council, the schools, the factories. And this is what we have been doing because it is made mandatory for us to do it. So our preparedness is right down to the minutest level, I like to think. But we also know there's always a turnover of staff. And when there is a turnover of staff, We need to retrain again, and this goes on and on. Number two is surveillance, risk assessment, and response. Our surveillance is very, very strong. I like to think too. And because every district, every state, we are required to look at our data because daily we do look at our data. It is a must to see what is going on. And also laboratories are being strengthened. So, but under the AIMST, we look at laboratories, a section on zoonosis, prevention through healthcare, risk communication, regional preparedness, alert and response, monitoring and evaluation. So we're actually going through all of this. So, and risk communication is also very, very important for us. So we go through this whole process whenever we do a simulation exercise because in terms of peace, that is all we can do. We do have all the very unusual outbreaks, sarcoidosis, etc. But we go through our risk communication. So under the with the AIMST, you can have AIMST, which is very good. It's for the Asia Pacific region. What Malaysia has done is, has got MySet, which is Malaysia's strategy for emerging diseases and public health emergencies. And this tool is now MySet 2, which is a work plan for 2017 to 21. And it has been adapted, translated, changed so that it is more relevant to our, what do you call it? To our national needs. So this is a national strategic work plan to strengthen the preparedness again to respond to new and recurring health threats globally, and is based on a bottom-up consultation. Again, it focuses on all the 8 areas. So for me to tell you one by one what we have done is quite impossible. I can only touch the concepts, and basically, I don't think it is anything new. It's just following the plan, doing it systematically, and going through the phases one by one. But we have a very good network of doctors, we have a very good network of public health system in this country, which is very strong and very good. And I have to move it out of the way. So we get a lot of events which we get reported from everybody, from GPs, health and clinic, hospitals. We don't have traditional healers anymore, sorry. But we do. We have acupuncture, we have, and in my working time at least, I have on occasion received calls from strange people, well, not strange, but anyway, telling me that, hey, I think this is this. And so we have our rumor system, which is also very good, and the grapevines. And events may be reported as clusters of cases of ILI, respiratory disease. The death could be due to an unexplained respiratory illness, pneumonia. So anything that is unusual, it gets reported. And people here are very good at reporting because another thing that we do every day is in every state, we have someone sitting there and opening the Malay newspapers, the Chinese newspapers, the English newspapers to see whether there's anything that is unusually reported sitting in one corner in a small little paragraph anywhere. So we have people who have been designated for these jobs. Read the papers in the morning so that we know and we are ahead or at least one step ahead. So our community is also, and now with this age, with this IT age, people are very quick to send up messages. And our problem actually was starting to read all the fake messages and trying to verify whether it was true or not. And that has become a very big problem because there's infodemiology or infodemics. It's a very big disease at the moment. So I think, okay, just to let you all know that in our mindset, it's not only the Ministry of Health. It is a multi-agency. It is a shared responsibility. In Malaysia, we have this National Disaster Management Agency, and their aim, or what we basically do, is to coordinate all the disasters in the country. So they are like a coordination agency. So when under the mindset, all these agencies are involved, and any others that may be needed to coming in at may be needed to come in at any one time. So let me end by just showing that there are so many simulation exercises that we do in times of peace, and we involve everybody, the hospitals, the health, the different agencies, and we also have regional exercises. This was a disaster in the Asian Regional Forum on Disaster Exercises, which was held in 2015. So we do take part in all these exercises, and we cover all the different disasters, from public health disaster to building collapse to floods to handling dead bodies. So all these have gone through. And again, this is also, I think this is my last slide. We do a simulation exercise. We make it real. We work with the hospitals. And this is pictures that I have taken. We work with the veterinary all the time. So our One Health approach has always been pretty strong, I think. And I know we were working on some unknown deaths in a turkey farm. So even though we didn't really have a role to play, because our role at that time was to make sure the humans were safe, but we go down together and we investigate together with the veterinary department. And of course, they take blood and whatnot. So in summary, we do need to invest in public health. I know our priority seems to be investing in high technology because we want to extend our lives, but actually our health depends on public health, basic public health. And a country like right now in COVID-19, you are strong as your public health is. So in investing in public health means a strong disease surveillance system. And it doesn't happen overnight, the surveillance system. You need to work on it. Every country needs to build on it. You need to train your workforce, and you need to make them competent right down to the lowest level. And you need to have your lab networks in place. Again, it is not something that happens overnight. It is built over the years. So we need a strong public health system with public health officials who are ready to coordinate emergency health responses. So you know that if you're working right now in the government hospitals and the government health, I know they are overwhelmed because number one, they're really tired. They've been working. Usually when SARS came about, it was about 3-4 months that we were very tired. But this has gone on for almost 9 months, and people are getting fatigued. So we need our research capacity to quickly develop outbreak countermeasure like vaccines and medicines, and you know. So with that, I think I am going to end here. So thank you very much.
And thank you, Doctor, for coming out of retirement here this evening to share with us some of the lessons that you've learned. And I just wanted to comment that a lot of the images and graphics in your presentation are fantastic. Thank you for sharing those. Let's see. Well, as far as questions go, I just want to remind the participants that you are welcome to type your questions into the chat box. We already have a question there from one of our participants. And it's, I got to warn you up front, this is a pretty serious subject. It's a pretty serious question. So the person says that they would like to know whether COVID-19 is also biological warfare.
Very difficult question to answer, but for all instances and for how much that we have found out, it is not, there's no proof that it is a biological warfare at this point in time. Diseases come out, new diseases do emerge. It could be accidental, but it could have been during the contact of the humans and the animals, but there's really no proof. And I
Yes, it
definitely
is
would,
that
yeah,
is a very challenging thing to answer, isn't it?
it is.
I don't think that there's one person that can prove an opinion in either direction. So I imagine that will be debated for a very long time, and I don't know if we'll ever know what the answer to that is. I wanted to draw your attention to a comment by one of our participants about how shared preparedness in the Asia Pacific region is very important to have, and they have concerns that countries are working in silo or have been working in silo, so not collaborating with one another. Is that something that you've seen change over your career? Do you think it's getting better?
Yes, definitely. Because during the early part of the years when I was working, we did get visitors, we worked, but not so much of collaboration as we see right now. So no matter whatever we do, whenever we try to do a simulation exercise, we definitely try to include our neighbors. And we do work together. And being part of the FATP network, I think we have a lot of shared interests and shared knowledge that we yeah that we have.
Yes, and on our session Monday, for those of you who are able to join us on Monday, we'll actually be talking about increasing cooperation between Mayahun and Vohun, two One Health networks that are very important regionally. And so we'll be talking a little bit about getting them to work more closely with one another. They're already doing a fantastic job, but we can always do better. So that will be one of the topics of Monday's presentation. I do have another question in the chat box. It's about food and water contamination. So if water and food were contaminated with bioterrorism agents, is there a plan to handle that specific kind of situation so that customers won't be affected?
For those who are living in Malaysia right now, there's no water in the Klang Valley because the water supply was contaminated and they have turned off water to 300,000 homes for now while they clean up. So things do happen. Water can get contaminated, whether intentional or otherwise. And our water supply comes from the rivers, so the rivers can get contaminated. So yes, there is a plan because we know the water reticulation system. We know exactly which is the source of our water supply, and you can only clean it up while in the process of close it up while in the process of cleaning.
Yes, it's a very serious
Did I
issue, and
answer?
a lot of countries have a specific plan in place for food or water incidents that's not exactly the same as they have in place for, say, incidents involving agricultural animals. And so having a specific plan for that event will be useful. We have another question, and it starts with a little bit of an explanation. It says, in order to reduce disease and promote health, public health must be an agent of change, behavioral change amongst individuals, and institutional change in societies. What are the ethical aspects of public health emergency preparedness and response?
Oh, very good and difficult questions. Sometimes when you think of ethics, we want to do good all the time, but you have to balance between good for the single person and good for the people, general good for the public, ethical aspects of public health emergencies. Tough one, right? When you have an emergency, I can only put myself into a situation right now in COVID. I'm very happy to say at this point in time, our health, the surge capacity, we haven't exceeded our surge capacity. So from the looks of it, the country can still manage with all the cases. I'm afraid it will come to a point that maybe we cannot manage all the cases in ICU, maybe. Not all the cases can go under ventilation or those who need it. Then best possible outcome. It goes by an individual one-to-one basis. It's very difficult to generalize for everyone. Did I answer the question?
I think so. And I agree that there are a lot of ethical issues with respect to this particular outbreak. And so it's hard to address them all. But one thing that I have noticed that stands out to me is the choices that individuals make. And what we need to be aware of course, is that an action that I take may put other people at risk. And I might take an action because I'm not well educated on this issue, and so I make a mistake. Or I might take an action because I'm just not really concerned about anyone else. If I were being selfish, I could really hurt other individuals. And so when you spoke earlier about individuals having a responsibility during an outbreak, that's what I was picturing in my mind. We have a lot of people who choose to not wear a mask, even though here in the United States, there is pretty good messaging letting people know that my mask actually protects everyone else, right? It's capturing, if I have virus, it's capturing it and it's keeping it close to me so it doesn't get out to other people. That's a very good function of a mask. There are a lot of people who choose not to wear it, which actually puts the people around them at risk. So there are a lot of very difficult ethical questions, and it goes back to individual responsibility and taking care of others as well as we would take care of ourselves. So very, very difficult thing, though, to get everyone to do that. So, very, very difficult to watch too, is to see people who are endangering others and not be able to help them to understand that they shouldn't be doing that. So I wanted to jump to our next question. This is pretty.
Sorry, Kelly. Can I just
Yes.
respond to that? Because I didn't touch
Yes,
that
please.
because I just gave a talk yesterday and I was, we have under our CDC Act, we have got 4 sections which says that basically what it says is you cannot do anything that would endanger the life of others and which may in any action of yours cause somebody else to get a disease. So here in Malaysia, it is compulsory, it is the law right now to wear a mask in public. And because you get compounded if you don't wear a mask, you will go out and you will find the whole community, basically the whole country, everybody is wearing a mask when they're outside. They cannot get into a shopping complex. They cannot get into a grocery store. They cannot get into the market if you don't have your mask on. So that was the reason why I didn't go into the mask, because everyone has got one here.
Everyone over there is cooperating and participating and taking care of each other. So very, very, very good news, right? Because they make a big difference. Masks very much do cut down on the transmission rate. There have been very few cases where we think possibly there's been transmission, even though both people are wearing a mask, but they've been spending an excessive amount of time in very close quarters with one another. So it could be other things, other factors that allowed that spread to take place. So yes, wear your mask. That would be the theme. Here's a great and interesting question. I hadn't thought of this. Since pets are so popular nowadays, will pets be the target of terrorists to spread zoonotic disease among humans? If so, will it be devastating like COVID-19 or be more serious than that even?
Oh, wow. Good question. Very interesting. And pets, keep your pets with you. But people are getting a lot of exotic pets. If you remember the monkeypox outbreak in the US a long time ago, That's because they were taking the prairie, what do you call it? The prairie fox, prairie dog. So, and it spread monkeypox to quite a few people, including the veterinarian who was taking care of of the of that animal. So pets can be used. Terrorists are very innovative these days. Anything can happen. There are a lot of I can't predict, and I can't give you ideas either. So yes, it is possible. Anything is possible.
Yeah, and it would seem to me different cultures value pets in different ways. There are some cultures in which pets are almost along the same level as a child in the family. They're
Yeah.
extremely valued, and in those societies, if you needed to control the disease by controlling the number of pets people have, by basically taking their pets away from them. And if you did that, 50% of the houses in my country have a pet. That's a lot of animals. There's nowhere for them all to go. So that would probably result in the euthanasia of those animals. So those animals would be killed. I think when you talk about terrorism, we need to think about different effects that terrorism have on countries. One is making people sick. That's kind of an obvious one, but some of the other stuff is financial damage to a country, emotional damage to the people of a country, hoping to change the foreign policy of a country. These are all goals that terrorists have. We usually think of the obvious ones that a lot of people got sick. But could you imagine for some of the countries on our planet how devastating it would be emotionally for the people in that country to deal with the fact that their own pets, the members of their family, are a vector of this disease, and so that the animals would be removed from them. So I don't know that necessarily because you use a pet that the disease that a human would suffer would be any worse than COVID-19. I think COVID-19 can be pretty serious. And I think we're rather lucky that it's not, as far as we can tell, transmitted from pets to humans. It can infect pets. It infects ferrets really well, apparently, and mink. And some people, I guess, have those as pets, but largely we're pretty lucky. But I think if you think about terrorism much more broadly, you can see that it's not all about the severity of the illness for the humans. There's a lot more going on there. So I would be concerned if that were to happen in our country. I think there would be a significant amount of social disruption as people's animals were being rounded up. It just wouldn't go over well here. So, and probably a lot of other places in the world. So that's a great question. That's a very creative thought process you have there. I am really glad that whoever asked that question works for the good guys, because that's a pretty dangerous thought you just had. So wonderful. Anyone else have questions they'd like to type in the chat box? Please go ahead. Doctor, I had a question for you. It's kind of I'm trying to think of personal responsibility, because you mentioned it in your talk today. Personal responsibility that we carry with us during an outbreak. Is there a personal responsibility that also people have when it's not a pandemic year? Are there things that they should do in their regular life that would help to maybe prevent a new or emerging disease from gaining a foothold in the human population?
There are so many aspects of that. We have always gone with our public health interventions, public health messages. We are hoping people will internalize just the basic habits your hand hygiene, your cough etiquette, your social distancing was never a problem before. But at least a few things like when you're ill, stay at home, when you cough, close your mouth, wash your hands, just the basic. But there is now forever going to be life before COVID and life after COVID. So the other health aspects that we have now internalized, hopefully after COVID, is going to stay with us for a very long time. And also, we also mention about pets because don't encroach into environment. And we had already so many other problems to deal with. We had climate change. We have deforestations where man was going into the forest and you're picking up. Will this stop? There are those who are living us in public health, carrying on with our work, and then there is also the other sector, which economically they need to do what they have to do. So we try and get a balance. Whether governments can stop all this, I don't know. But for us as an individual, we do what we can. Even the other smaller things like recycling, don't waste, don't, what do you call it? Food waste is so much, especially in the more affluent countries. Recycling, we try to do what we can, no matter how small it is. I'm very much into recycling. I don't use plastics. As far as possible, I stop drinking from water bottles. Although unconsciously, subconsciously, I know that if I were to travel and I go to another country, I'm not sure I'll go buy a mineral water bottle. So changes can be made by an individual, no matter how small, and I think if everybody does it, it will go a long way.
Yes, there's strength in numbers. Any one person's action, if it's a good action, if other people do that same thing, it's the power of all of us doing it. So it is good to hear you thinking about the world as one big planet, and everything is connected and interrelated. And if we damage one portion of it, we will see those effects throughout the rest of the portions of our planet. So if you damage plants, that will damage animals. And if you damage animals, that will damage people. And if you do all that, there's damage to the environment as well. So very important to be thinking broadly. Speaking of thinking broadly, one of our participants brought up a very good observation. So we talk about people in COVID-19 needing to socially distance. So they need to be, I don't know what the rule is where you're at, but here we need to be at least 6 feet apart from one another. Well, they brought up that may not be a very good term for what we're actually asking people to do. We're not asking them to socially distance, we're asking them to physically distance from one another. And so the reason why I think this is a great observation is not just because of the way the words are being used, but because they're pointing out that virtually we're capable of being quite social. As a matter of fact, I right now, because of Zoom and because of AIMST and what AIMST is doing and what Southeast Asia is doing, I'm meeting more people that I would never have met before and getting to talk to them in real time over this technology. And so we're not socially distant, not in that way. And so maybe we can use the social opportunities we have now to talk to people overseas about this concept, to build that cooperation that we need to keep a healthy planet, to make a planet that's more resilient if something were to go wrong. So I just want to thank our participant for pointing that difference out, because we should make every effort to continue to be social with one another and to share our struggles and our lessons learned, in spite of the fact that we can't be within 6 feet of each other. Or I've seen some other really funny graphics. There's a social distancing graphic out of Russia that shows 2 people with a bear standing in between the 2 of them, because the bear happens to be just big enough to keep those two people apart. So be creative, find something relevant and funny in your country that could be put between two people to keep them just far enough apart, and make a poster out of that so everybody can get a smile today. So in addition to that, I also want to, we have at least a few minutes left here. I want to be sensitive to the fact that we may have participants who, for whatever reason, cannot type their question. So with your permission, I'd like to go ahead and just give a moment of silence on the microphone, just in case one of our participants needs to unmute theirs to ask their question. So I'm not hearing anyone speak up at this point. So I have one final question for you. And it's an unusual one. Are you ready for this?
Oh, let's try it.
You and I, we can't change our own genomes so that ourselves are better adapted to the world around us. So if the world suddenly changes, you and I can't change our genes to be better adapted to it. In fact, change, genetic adaptation actually takes place when species reproduce. And that's when species are able to adapt to new and changing things about the earth. Now, in working with bacteria and viruses my whole life, I've noticed that they produce every 20 minutes or every hour. So they reproduce more quickly than we do, which gives them an opportunity to genetically adapt more quickly than we can. Do you think that that means that they have some sort of competitive advantage? And do we have to worry that there'll be an outbreak in our future where that organism is adapting so quickly that it's able to have antibiotic resistance very quickly, or have a vaccine escape strain, and it will outcompete us? In other words, are the microorganisms going to win someday?
I'm not a microbiologist, but looking at how we are still struggling after so many months to get a proper vaccine just for COVID-19, it is possible and it is likely. And also seeing all the multi-drug resistant TBs, we have got patients who are resistant to everything. They're walking around though, but totally drug resistant. So yes, it is possible. And it is a very scary thought.
Yes, so our lesson for today is for all of our people to take very good care of the earth, and to be watchful and mindful of the fact that all of these incidents start locally. And our best chance of stopping something is stopping it while it's still local. And that can change pretty quickly. So if you as a practitioner, if you as a researcher, if you as a student of the world notice a situation with patients, with animals, that's outside of the norm, you may want to consider to err on the side of safety and let the reporting mechanism in your country work. Let someone else know so they can get to it early and investigate it early. It may not be anything bad. It may not be an emergency. But if it is, you have a very short time for people to do something about it. So trust your instincts. If you think something is wrong, it probably is. So I want to thank everybody for being a part of our audience this evening. I want to thank you for being our speaker and for answering questions. It was a joy moderating the session with you. Thank you as well to Dr. Subhash for inviting me to be able to do so, and AIMST University for being so proactive about biosafety and biosecurity. So with that, I'd like to turn everything over to our MC to close out the session. Thank you, Doctor.
Thank you.
Thank you, Dr. Susan. Before I proceed further, I would like to pass over to Dr. Subhash. He want to add something. Dr. Subhash, please. Dr. Subhash, you're muted.
Thank you very much, Kanchana. All the audience, I just want to inform you because Dr. Susan Kelly is moderating our webinars. This one is webinar number 3. She has moderated webinar number 5, 6, and this one is the third one. And Monday she will be with us, and that one will be very special session. So at the beginning, because of all these programs, I'm meeting her frequently during nights. So I so I missed one thing. I did one mistake at the beginning. I didn't introduce Susan. So I want to correct my mistake. Okay. So I just want to tell a little bit about Susan. Susan carries a bachelor's degree in organizational psychology from Purdue University. Her doctorate degree is in veterinary medicine from University of California at Davis. And she has earned a postdoctoral master's in comparative pathology while conducting vaccine research at California National Primate Research Center. Currently, she is a principal member of the technical staff for the Global Chemical and Biological Security Group at the Sandia National Laboratories, United States of America. She have a passion for biosafety and biosecurity, or you can say biorisk management. She have a vast experience. Her work focuses on entire work focuses on chemical, biological, and radiological safety and security. And it's something great I want to tell you. She was carefully chosen several times as a consultant on various United States of America's federal government's projects over the past decade due to her extensive experience in clinical practice, diagnostic laboratories, research laboratories, and response. And she's also a member of the Phi Beta Kappa National and Golden Key International Honor Societies. I mean, I can add lots of things, but these are the essential things participants should know. So Susan, please accept my apology. I did a mistake at the beginning. Thank you. Thank you.
You're welcome, and thank you very much. It's no problem at all.
Kanchana, over to you.
Thank you, Dr. Subhash. I would like to take this opportunity to thank our wonderful speaker, Dr. Bina Rai, as well as our today's moderator, Dr. Susan. On the behalf of organizing committee, I'm also thanking to all the participants for joining us on our program of Biosafety and Biosecurity Month, October 2020 at AIMST University. Before ending the session, we would like to hear feedback from all the participants by scanning the QR code that's shown in the screen right now. You can either scan the QR code or go to the link given. The link will also be provided in our chat box in a short while. We ensure you that it won't take more than 1 minute for you to complete the evaluation survey. Upon completion of this evaluation survey, you will receive an instant certificate. I will keep the screen running for 2 more minutes in order for everyone to scan both the QR codes. Once again, thank you. We are hoping to see all of you in our next session. Stay safe and stay healthy. I hope everyone have scanned the QR code by now. I'm going to end the meeting. Stay safe and have a wonderful day ahead.